Hello everyone, welcome to our Mind Your Health seminar today. My name is Callie Johnson and we are going to talk about metabolic syndrome. So here on the slides we have 5 different terms. This metabolic syndrome, hypertriglyceridemic waste, insulin resistance syndrome, obesity syndrome, and syndrome X. And these are all terms that are used for metabolic syndrome. And on our agenda for today, we are talking about what is metabolic syndrome, recognizing the warning signs, creating healthy habits to reduce our risk, and talking about those next steps. And one thing I do want to point out here is at the bottom of the slide, it does say this information is intended for educational purposes only and should not be interpreted as medical advice. So something to keep in mind here, this can only be diagnosed by your doctor, so if there's any concerns, talking to them would be the best option. So to start off with a pop quiz here, true or false, metabolic syndrome is a newly identified health concern. And this actually is false. So the term metabolic syndrome has become widely used since its creation in 2001. However, independent scientists have published reports as early back as the early 1920s. Which is why we have a number of terms to describe it, because there have been so many terms used throughout the years. So the big question, what is metabolic syndrome? It is the name for a group of metabolic risk factors that, when they occur together, may increase your risk for heart disease, stroke, and type 2 diabetes. According to the American Heart Association, about 23%, or about 1 in 4 almost, of U.S. adults have metabolic syndrome. Studies show that individuals with this syndrome are twice as likely to develop heart disease and 5 times more likely to develop type 2 diabetes. So are you at risk? Here on the screen we have 5 different risk factors. The first one is abdominal obesity. So this is sometimes referred to as having an apple shape. And this can increase your risk of developing heart disease and type 2 diabetes. And the criteria for this is that men have a waist circumference of greater than 40 inches, whereas women is over 35 inches. The next risk factor here is high blood pressure. Over time, high blood pressure can damage your heart, lead to plaque buildup. Uncontrolled high blood pressure can also lead to heart and kidney disease, stroke, blindness. And this is a risk factor if either the number on top or the number on the bottom is too high. And right here, the criteria is 130 over 85. So if we're over that 130 mark or over that 85 mark, then we have high blood pressure. The third risk factor here is high blood triglycerides. So this is a type of fat found in the body, and it's been associated with heart disease, diabetes, fatty liver disease, and it's often measured when you get your cholesterol checked. So the next time you get your cholesterol checked, you can see your triglyceride levels. And the criteria here is 150 or higher is when we consider it a risk factor. The fourth factor here is low HDL. HDL is our good cholesterol. So this can low levels of HDL can increase your risk for heart disease, just like high levels of LDL, which is considered our bad cholesterol. HDL, the good cholesterol, their job is to remove the bad cholesterol from your arteries and carry it back to the liver so that it can't build up and lead to possibly atherosclerosis, just kind of like with our high blood pressure here. And the criteria for low HDL is if it's less than 40 in men and less than 50 in women. And the fifth and final risk factor here is high blood sugar. So this can be a sign of prediabetes or diabetes, and if it's uncontrolled, it can cause problems that affect almost every part of the body. And the criteria is if it's at 100 or higher. Now, overall, you don't need to have all of these or one of these. You can be at risk for metabolic syndrome if you've checked off 3 or more. So those are just good things to keep in mind as we move forward. So looking a little deeper into those risk factors, here we have a table that talks about our desirable levels, our borderline high risk, and our high risk. So now those high risk points are generally kind of what we were seeing at our risk factors in the previous slide. Now remember, most of these really can't be diagnosed unless you have your doctor involved. So obviously, again, seek out medical help if we're concerned about any of these. But just go over these a little bit more. Our desirable levels here for abdominal obesity are to have a waist circumference of less than 40 inches for men and less than 35 for women, just like we talked about previously. For blood pressure, we want less than 120 and less than 80. So our top number should be less than 120 and our bottom number should be less than 80. Our triglyceride levels, we'd like to have it less than 150. HDL, we want it to be higher than 40 in men and higher than 50 in women. And our blood sugar, we'd like it to be between 70 and 99. You will see that for a few of the factors, they do have a borderline high risk. It's that thing right in the middle, and that's when we can also see a higher risk. We have another pop quiz here. True or false? Metabolic syndrome is becoming more common due to a rise in obesity rates among adults. And as you can see here, this is true. There has been a dramatic increase in obesity in the United States since 1990. The map on this slide shows the prevalence of obesity, which here is defined as adults with a BMI of 30 or greater in each state. So what causes metabolic syndrome? We've already talked about the risk factors, but we haven't talked about the causes yet. And there are several causes that act together. Some of these we can control, and some of them we can't. And so our uncontrollable risks here are aging and genetics. And then on our next slide, we will talk about the controllable ones. And there's actually more controllable than uncontrollable risks, which is great. So our controllable risks here are overweight and obesity, an inactive lifestyle, high blood pressure, and insulin resistance. Something to point out here is that obesity, blood pressure, and insulin resistance can all have genetic components to them, but there are many ways in which we can manage them on our own. And so the safest and most effective way to prevent or treat metabolic syndrome is to make positive lifestyle changes. So speaking of positive lifestyle changes, let's look at creating healthy habits to reduce our risk of metabolic syndrome. So a big thing to keep in mind when we're creating healthy habits is that as human beings, we are creatures of habit, and we're social by nature, meaning that we need to connect with other human beings in some way in order to be happy and to feel good. We also want things to be easy and convenient, and we like to have fun, which isn't a surprise. We would rather do something that we want to do rather than something that we feel like we have to do or something that we hate doing. So taking a closer look at our controllable risk factors here, big one here is to get active. The benefits of an active lifestyle, there are tons of them. We have more quality of life benefits, such as having more energy, having a better sleep quality, reducing stress, improving our cognitive thinking and our self-esteem. And we have some more medical benefits, like lowering our blood pressure, improving our cholesterol, lowering chance for diabetes, heart attack, strokes, and preventing other diseases like osteoporosis and cancer. So now that we know the benefits of leading an active lifestyle, let's circle back around to creating those positive, healthy habits. So to create active habits, a big thing we have to do is make a list of activities that we enjoy. Remember, we are creatures of habits and we like to do things that are fun. So if we want to do these activities because we enjoy them, we're more likely to stick with them. So that is our big first step to take. The next one is adding variety. So in order to not get stuck in a rut or get bored, it's important to shake things up and add some variety so we don't become stagnant. The next one we have here is including strength training. This could include weights, resistance bands, or body weight like a push-up. And this is a really foundational piece of creating a well-rounded activity lifestyle. The fourth one here is keeping a physical activity log. This is a great way to keep ourselves accountable. We can track this in a notebook and a wellness website, and this is great because it also helps us look back on the progress that we've made. Our next one here is joining an exercise group or finding a fitness buddy. This is a really great idea. This not only keeps us accountable, like our physical activity log, because we have somebody else to motivate us and encourage us, it also satisfies that social piece. Because like we said, being social is a huge part of being human. So this is a great way to meet that, and it can also make it more fun. Our next one here is making your environment fit friendly. This is a big thing to making it easy, making it convenient. This could be as simple as keeping your tennis shoes by the door so that you can go on a walk easier, or having a standing desk at work, or anything else that makes getting active just a little bit easier throughout your day. And then our last two here kind of go together. So this is adding more movement throughout our day and slowly building up to 30 minutes or more daily. So we don't need to go on a 2-hour run to go live an healthy, active lifestyle. We can just walk for 10 minutes, 20 minutes, and try to really build up to that 30 minutes a day, because that's going to be more sustainable. And as we're going up in slow increments and not going too hard too fast, but it's easier, and it's easier to fit throughout our day. It's easier to go on a 10-minute walk when you're on your lunch break at work than it is to try to fit in an hour run in the morning. So the easier that we can to build those things up, and the easier we can make that, the more likely we are to get exercise. The next healthy habit we want to build is eating better. So a balanced diet looks different for a lot of people, but it can help you feel your best. It can provide nutrients for your health. It can fuel your mental and physical performance. None of us feel good when we haven't eaten very much throughout the day, or when we've eaten foods that don't make us feel good. So making sure we're fueling our body to help us work the best that we can. And then supporting a healthy body weight. And of course, it plays a major role in chronic disease prevention and treatment. So these are all really large benefits to eating better. So how do we create these healthy eating habits? So this first one here is very similar to what we had in our physical activity slide. And this is making a list of healthy foods that we enjoy, right? We're not going to like eating foods that we hate the taste of. So if we can make a list of foods that we enjoy and kind of stick that in our weekly grocery list, it's going to be a lot easier to eat healthy and develop those healthy eating patterns over time. The next one is adding variety, just like in our physical activity log as well. No one wants to eat the same thing every day. It gets really boring really fast. So if we can add variety, that's going to really help us stay on track to eating healthy, but also actually enjoy what we're eating. The next one is keeping a food log. Now we know this can be a little bit tedious, but it does help us in a lot of ways. It can make us more aware of what we're eating and how much. It doesn't have to be every day either. This could be just a couple days, every month, just as periodic checkups to let you know if you're staying on track or not. The next one we have here is getting our entire family involved. So this can be a great way to help keep us accountable, and really provide that social piece, because you'll have multiple people doing this with you. Our next one is creating a healthy food environment. So we can ask ourselves the question of what small changes can we make at home or at work that would support our healthy eating habits. Maybe this means keeping healthy snacks close by so we're not tempted to reach toward those unhealthy ones, or making sure that we have more healthy foods in the home. So these are all just really good things to think about to make things easier, because like we said before, we want things to be easy and convenient. And our last one here is slowly incorporating more healthy foods into our daily diet. So this is, again, similar to our physical activity slide, that it's a lot easier if we build up small habits over time than if we go too hard too fast, because it's normally not very sustainable. So if we can create just small changes, it's not going to stress us out, and it's going to be a lot easier to stick to those healthy habits. Our next healthy habit that we should be trying to build is achieving a healthy body weight. So the benefits of a healthy body weight, we have more energy, better health, we feel better, we enjoy traveling, we can feel more confident and in control, be around for the next generations to come, and be able to keep up with any children that you might have right now. So a few small steps we can take to achieve that healthy body weight are choosing smaller portions, keeping our healthy options nearby, just like we said in our last Eating Better slide, keeping it convenient, keeping healthy eating easy and convenient to us is a really easy way to eat healthy and to eat better and to really keep track of that. The next one we have here is slowing down to enjoy our meals and our snacks and eliminating distractions. So I'm sure most of us have kind of ate mindlessly in front of the TV or while on our phone. That's pretty normal. But eliminating those extra distractions can help us stay in tune with our body more so that we can feel when we are full, so we're not overeating. And our last one here is eating out less often or choosing more nutritious options. So meals eaten away from home tend to have fewer nutrients, and you don't have as much control over how those foods are prepared, so you don't know what is being added to them. So we should be aiming to preparing more meals at home, but for when we do want to eat out, because that's always fun, making simple changes such as choosing a side salad or asking for condiments on the side can help you have a little more control over the foods that you're eating and choosing more nutritious options. So right here we have a slide on quitting tobacco. So while this isn't one of the 5 conditions that was listed as a risk factor, studies show that smoking might also increase the risk of developing metabolic syndrome. Tobacco harms nearly every organ in the body, but the good news is it's never too late to quit. According to the American Cancer Society, people who quit smoking before the age of 40 can reduce their risk of dying prematurely from smoking-related diseases by about 90%. And while quitting at a younger age will further decrease health risks, quitting at any age can add years back to your life. And the benefits, there's so many of them. The benefits we have here are better health, able to breathe easier, improved sense of taste and smell, which is always good, more energy, clean breath, softer skin and fewer wrinkles, just being a better role model for the people around you. There's also saving money, being more confident, improving our heart rate and our blood pressure, and reducing risk of heart disease and other forms of cancer. So a few tips on quitting tobacco smoking, just as we would plan a trip ahead. There's also a few things that we should plan when we're preparing to quit smoking. The first one here is just making a firm decision to quit. Making that firm decision means you've decided that no matter what, you're not going to use tobacco, and when this happens, your internal debate stops. So we stop debating whether we should or we shouldn't. When we make that firm decision, our brain is ready to go. Our next one we have here is using nicotine replacement therapy or cessation medications. This can be like nicotine gum or different medications that can help us lower our nicotine use over time, so we're not just quitting cold turkey. Our next one is creating a supportive environment. So this is also really essential. We said that we're social creatures, and this is a big way that this comes into play. So many people pride themselves on being self-reliant and independent and strong-willed, but trying to quit alone can be really hard without the support of others. So having that supportive environment around you to help keep you accountable, but also encourage you and motivate you to keep going on your journey here is really important. The next one is taking advantage of all the resources available to you to quit. There's probably more resources out there than we know about, so making sure we're using all of those can only increase our chances. And then when combined, these steps can multiply your efforts. So just one of these is good, but if you use all 4 of them, it's again going to make it that much easier to quit. So like we've said before, working with your healthcare provider is incredibly important during this. So many chronic health conditions can be detected early on with routine screenings, and your personal doctor is the best person to help you determine what screenings you need and how often. But to assess your risk for metabolic syndrome, your doctor should be regularly screening you for high blood pressure, high cholesterol levels, and your risk of developing diabetes. And if you don't have a regular doctor, you can check with your health insurance carrier to find covered providers in your area. So our next factor here is blood pressure. We've talked about it a little bit before when we talked about risk factors, but we're going to talk about it a little bit deeper here. So the heart muscle is really unique compared to other muscles throughout the body. It delivers blood rich with oxygen and other nutrients to the body using this whole system of blood vessels called arteries. We also have veins and capillaries and a few other structures in there as well. But when our arteries are healthy and dilated, blood flows super easily through them, and your heart doesn't have to work very hard to kind of pump blood throughout your entire body. But when your arteries are too narrow or stiff, your blood pressure rises and your heart works really hard. And this can damage your arteries and over time lead to scarring and hardening of the artery walls, which is something called atherosclerosis. And like we just said here, like uncontrolled high blood pressure can lead to this. It can also lead to heart and kidney disease, stroke, and blindness. And it can affect other areas of the body, which can lead to sexual dysfunction, bone loss, and sleeping problems. So it's pretty easy to see here that blood pressure is a really big problem, or it can be. So like we see in this little green box over here, reducing it's really important, and we can reduce our risk of developing high blood pressure by maintaining a healthy body weight, following a healthy eating plan, which includes foods lower in sodium. This is like the DASH diet that it includes on the slide here. And one key to lowering sodium is by limiting the amount of processed foods that we eat. The DASH diet was developed by the National Heart, Lung, and Blood Institute, and it's low in saturated fat, total fat, and foods high in added sugar. And it emphasizes the intake of fruits, vegetables, and fat-free or low-fat milk and milk products. And it also includes whole grain products, fish, poultry, and nuts. So this is a really well-rounded diet that can help lower our risk for high blood pressure. The next factor we have here to reducing risk is to be active on most days of the week, like we've said before, managing your stress, limiting alcohol so that we're drinking in moderation, and trying to quit smoking as much as we can. The next factor we have here is cholesterol. Like we said, we've talked about this a little bit before, but to go deeper into it, cholesterol is a fat-like substance that is produced in the body, primarily in the liver. It is part of every cell membrane in the body and is a component of many different hormones, and it's essential for good health. And the liver makes all the cholesterol that we need, but we also get it from some of the foods that we eat. So since our body creates it, it's not necessarily bad in itself, but it becomes a problem when we have too much of it in our system. So high cholesterol is a major risk factor for heart disease, stroke, and heart attack. High levels of LDL, or that bad cholesterol, can contribute to plaque buildup on the artery walls that over time can lead to atherosclerosis. This can also be if we have low levels of HDL or our good cholesterol, because our HDL works to kind of take out that bad cholesterol. So if we don't have high enough levels of that, then our LDL is allowed to kind of become out of control. And if this plaque builds up and an artery becomes completely blocked, that's when a heart attack or a stroke can occur. And having other risk factors such as diabetes, high blood pressure, or being overweight can even further your risk. So it's really important to control these different factors, including cholesterol. So in that little orange box we have off to the side, we have a few different ways that we can reduce our risk of developing high cholesterol. This first one is, again, maintaining a healthy body weight. The next one is, again, similar to with blood pressure, following a healthy eating plan that includes foods lower in saturated and trans fats. The American Heart Association recommends following a dietary plan that emphasizes fruits and vegetables, whole grains, poultry, fish, and nuts while limiting red meat and sugary foods and drinks, which is relatively similar to the DASH diet. They also recommend being active on most days of the week, drinking alcohol in moderation, and again, quitting smoking if you can. This next factor here is blood glucose. So type 2 diabetes is a disease in which the body does not produce or properly use insulin, which is a hormone that is made in the pancreas that is needed to move glucose or blood sugar from the blood into your cells where it's used for energy. And I'm sure most of us know somebody with diabetes who uses insulin. This is a way to help supply the body with insulin that it may not be creating itself or its cells are resisting. That's something that happens with type 2 diabetes, is that insulin maybe isn't being produced, or the cells are resisting it, which is when your blood sugar levels go too high, which is why a lot of diabetics use insulin to help control that. But over time, if these levels are not controlled, they can cause problems that affect almost every part of the body, including our eyes, our gums, teeth, heart and blood vessels, stomach, kidneys, nerves, and skin. And again, this is when they're uncontrolled blood sugar levels over time. So reducing our risk of developing diabetes is really important, because it's one thing to manage diabetes when we have it, and that's a wonderful thing, but to reduce our risk altogether of developing it is even better. So to do that, we can again maintain a healthy body weight. We can follow an eating plan, which includes a colorful variety of fruits and vegetables, beans, peas and lentils, fish that is rich in high omega-3 fatty acids, and then low-fat dairy products, healthy fats such as olive and canola oil, and lean meats. And so we want to limit foods also high in saturated fats, such as bacon, or butter, and then sweets and desserts, sugary drinks that are all high in added sugars, because this increases our blood sugars even more. And some individuals may benefit from breaking meals into 5 or 6 smaller meals to help control portions rather than having 3 big meals. And then our last factor here is to try to be active on most days of the week. Being active can actually help our body take in our blood sugar a little bit more. So being active can help control that as well. So I know that was just a lot of information overall, but in summary here, the big takeaways are to be as active as we can, try to eat well, maintain and achieve a healthy body weight, try to quit smoking, and then working with our healthcare provider to really make sure we're catching these symptoms or these different conditions early on so that we can manage them easier going forward. So thinking about our next steps here, taking a little bit of time to think about what we've discussed today and writing down a small step you can do this week to reduce your risk of developing metabolic syndrome can be a great way to kickstart our next step. And trying to build up these things over time as well is a really great option. Thank you so much for joining us today in this Mind Your Health seminar of metabolic syndrome. And we hope you learned something and have a great day.